I know you're a pediatrician, so your focus is children, but it seems like your focus now is really all people because this COVID-19 has impacted us all greatly across the world. The questions that we received today about opening school, some of the opinions might be political, meaning, the economy needs to get going. We need kids. We need a place for kids to be. That puts teachers in a bad position. That's the political mindset. From the other side of it is, we have children who are in poverty. We have children who live in multifamily homes. They may be safer at school. But the fear of the multifamily homes and the children being impacted by multiple adults who are out working in various markets, coming home, potentially carrying the virus to school, to the staff. Do you have any advice for the moms and dads and families who are at home, maybe living in with multiple families due to whatever reason? Do you have any advice for what they can do at home to lower that impact of that virus potentially spreading?
So there's two principles. One is you want to shrink your social circle as much as possible. And in a multifamily home with multiple people working and going out of the home, that's really hard to do, but you do the best you can. And limit social engagements as much as possible so you're not exposed to too many people. I want to remind everybody that we've only had about 1% of our citizens in Arkansas that have been infected. So 99% have not. Most of the people you encounter are not going to be infected. But to limit the chances that you run into that 1% person when they're infected, you try to shrink your social circle down as much as possible. The question about, the other question that's sort of linked to that, Dr. Cleveland, is the issue of intergenerational families, people that have grandparents that are living in the home as well. And we know that those people are at the highest risk of mortality and hospitalization if they get coronavirus disease. That's a really hard one. That is really a struggle. And I think it is the middle generations who bear most of the responsibility there, and less the children. The children, as we mentioned before, are less likely to bring an infection home and spread it to a grandparent. It can happen, and I do worry particularly about teenagers and college-age students. But it is the working adults, the parent age group that tend to get infection, to become symptomatic, and to spread very, very effectively. The other aspect of, I mentioned limiting your social circle. The other one is sort of what you do outside of the home when you go to the grocery store and you go to all these other places. I'm very heartened that the governor has made the decision to mandate masking in Arkansas, which happened yesterday, and will go into place this coming Monday. This is sending a very important symbolic message to the people of Arkansas that, this is very serious. We have to pay attention to it. And I'm hopeful that there will be fewer people in stores. Of those that are there, they'll be wearing masks and keeping distance. It's very important for families at home when they leave to go to the grocery store, drugstore, hardware store, whatever, to try to find times when they're not busy. Don't take your children there. Go in by yourself, do your business, and get the heck out of there as fast as you can. Wear the mask, wash use alcohol gel after you get out of the store in case you've handled baskets or other things that other people's hands have been on. Those are the main things. And then the final thing is sort of a mental health thing about how do you manage fear. I think that all of us have probably woken up at 2 a.m. In the last few months, worried about a family member or yourself that might have been exposed or might have had a situation where they could acquire this disease. And what's going to happen when the hospitals are full and there's no place left to go? We've all woken up with those moments. I think right now, managing fear is done by recognizing what you can do as an individual. And it's always been that way. When you go out on the highway, there's a chance that somebody's been drinking is going to cross a line and hit you, and there's nothing you can do about that other than to be very alert, pay attention, and do everything you can to prevent an accident. Same thing with this. You've got to be rigorous about wearing your mask when you're out and keeping social distance. If you do that, and it's, the truth is these things are not that hard to do. They're relatively easy things to do. It's hard to remember them. It's hard to get in the habit of doing these things, but we all have to help each other do that. And that's why I think the mask rule mandate that was passed will help us all move in the right direction. I'm very grateful for the governor for doing that.